Hey friends, let's dive into a super important topic today, trauma-informed care. Trauma is any deeply distressing experience. It can come from personal events like loss or abuse, or even large-scale events like political unrest. And let's be real, right now, the political atmosphere can feel overwhelming. Understanding trauma categories and examples. Acute trauma, resulting from a single traumatic event. Practical example, a car accident, a natural disaster, or a sudden death of a loved one, which often result in symptoms like shock, confusion, and anxiety. Chronic trauma is repeated and prolonged exposure to traumatic events. For instance, ongoing abuse, whether physical, emotional, or sexual, living in a war zone, or experiencing long-term bullying. This can affect our mental health with symptoms such as post-traumatic stress disorder and depression. Complex trauma involves exposure to multiple traumatic events, usually of an invasive, interpersonal nature. A practical example would be a child growing up in an unstable household, with neglect or abuse from caregivers over many years. This has long-lasting effects on relationships and self-esteem. Developmental trauma occurs during the critical developmental stages of childhood. For example, emotional neglect, foster care placement, or parental substance abuse can significantly impact a child's development. This affects emotional regulation and cognitive functioning later in life. Secondary or vicarious trauma is the trauma experienced indirectly by witnessing or hearing about someone else's traumatic experience. For example, mental health professionals, emergency responders, or first responders are often exposed to clients' traumatic stories. Historical trauma refers to the cumulative emotional and psychological wounds passed down through generations within a specific group. A practical example would be the impact of colonization on indigenous populations, or the legacy of slavery on African American communities. This kind of trauma has a profound effect on community health and identity. So, how does trauma seep into our daily lives? Well, it can lead to anxiety, mood swings, and feelings of disconnect. You might find yourself feeling easily overwhelmed or on edge. These are some signs someone might be experiencing trauma. Let's break it down. Complex trauma can have profound effects on a person's emotional, mental, and physical well-being. Here are some signs that someone may be experiencing complex trauma. Emotional signs include persistent sadness or depression, constant feelings of hopelessness or despair, anxiety or panic attacks, heightened state of anxiety or frequent panic attacks, mood swings, intense and fluctuating emotions including irritability or anger, emotional numbness, difficulty feeling emotions or a sense of detachment from one's feelings. Behavioral signs include avoidance, steering clear of situations or reminders of the trauma, self-isolation, withdrawing from friends, family, and previously enjoyed activities. Substance abuse signs include increased reliance on drugs or alcohol as a coping mechanism, self-harm, engaging in self-injurious behavior as a way to cope with emotional pain. Cognitive signs can manifest in various ways. Difficulty concentrating might show up as trouble focusing on tasks or making decisions. Negative self-perception often comes with persistent feelings of worthlessness or shame. Intrusive thoughts can be recurrent, unwanted memories or flashbacks of the traumatic events. And dissociation involves experiencing detachment from reality or oneself, often as a coping mechanism. Physical signs are also quite telling. Chronic pain involves ongoing physical complaints without a clear medical cause. Fatigue is a constant tiredness, even after adequate rest. Sleep disturbances include insomnia, nightmares, or other sleep-related issues. And changes in appetite can lead to significant weight loss or gain due to stress-related eating habits. Interpersonal signs are crucial to recognize. Difficulty trusting others often means trouble forming or maintaining healthy relationships due to fear of betrayal. Fear of intimacy can lead to hesitance or avoidance when it comes to emotional closeness with others. An overreaction to normal stressors means responding disproportionately to everyday challenges. Constantly on edge or irritable. Avoiding certain places or topics. Having trouble sleeping or concentrating. Experiencing physical symptoms like headaches or stomach aches. Withdrawing from social interactions. Recognizing these signs is the first step. It's so important to support each other and create safe spaces for healing. Trauma-informed care means understanding how trauma affects us and responding with compassion. We're all in this together. Remember, it's okay to ask for help. Let's start the conversation and break the stigma around mental health. Drop a comment below with your thoughts. Let's heal together.